Welcome, my name is Peter Strong. I'm a professional online therapist specializing in teaching mindfulness therapy for anxiety and depression and addictions, and also for PTSD. If you're looking for online help for overcoming anxiety or depression or any other form of emotional suffering, then please go to my website and learn more about this online therapy service, and then contact me if you have any questions and to schedule a Skype therapy session. So, mindfulness therapy provides one of the best approaches for working with the mind, with thoughts, with difficult emotional reactions, with painful and traumatic memories, and compulsive patterns of thinking and behaving. So mindfulness therapy is particularly good for working with OCD and other anxiety disorders. It teaches you how to break free from the psychological habits whereby you become reactively identified with your thoughts and emotions and beliefs. This is the biggest problem that we encounter, that we call reactive identification. So thoughts, for example, may get triggered in the mind, and then we simply become completely consumed by those thoughts. They overwhelm us, and they cause more thoughts in reaction to those first thoughts. So there's this proliferation of uncontrolled reactive thinking, and that feeds anxiety and depression and emotional trauma, and of course the compulsive behaviors that accompany OCD and addictions. So learning how to work with thoughts and emotions is extremely important. The way we do this is by actually developing skills at meditating on those emotions and those intrusive thoughts, as well as meditating on traumatic memories. We have to overcome the natural reactive tendency to avoid and distract ourselves away from painful emotions. This simply leaves them unresolved, and then they will continue to return and proliferate. So we have to reverse avoidance and instead develop more conscious awareness around these painful emotions. And that is the first part of the training in mindfulness therapy. We learn to meditate on these emotions, which means we learn how to establish balance and overcome this pattern of reactive identification and further reactivity that feeds the underlying emotional pain and prevents it from healing. When you can sit with your anxiety without becoming anxious, then things begin to change very quickly indeed. So that's the first part of our training in mindfulness therapy. And the second part of our mindfulness therapy training is learning how to actually help painful emotions heal, how to change the internal imagery that creates those emotions in the first place. We look at the emotional imagery, the way that we see anxiety or depression or trauma in the mind. This imagery is what causes our emotional suffering. And the imagery is habitual by nature, and it simply operates in a conditioned manner as a psychological habit. So when we bring mindfulness to this, we begin to uncover this imagery, and we begin to explore ways of changing that imagery so that the emotion subsides. So you can learn how to resolve the emotional suffering around a traumatic event, for example. Or you can learn to reduce and neutralize the imagery of anxiety or depression or any other form of emotional suffering. So it's all about learning how to overcome these conditioned reactive habits. That's the real cause of our emotional suffering. And mindfulness therapy provides the tools for doing this. If you would like to get started with mindfulness therapy with me, then simply send me an email and let's schedule a therapy session over Skype so that you can begin to learn these mindfulness techniques. Most people see quite remarkable changes after just the first 3 or 4 sessions. It's because you're learning how to work directly with your emotions. Talking about your emotions is seldom sufficient to overcome significant chronic emotional suffering. Medications will do nothing to change the underlying cause of your emotional suffering, but actually bringing conscious awareness to the mechanism that causes our suffering is by far the most effective way of healing. So if you'd like to get started with me, do please contact me and let's schedule a therapy session over Skype. Thank you.